Peter Drury, Sky Sports Print.
All right. Good evening. You're welcome to my live today. It's exactly 7:30 or 19 hours East African time. Welcome to our live today. And like I've already said, we are going to be answering your questions. Welcome to Ask Dr. UTHUMAN YouTube channel. For those of you who are watching this channel for the very first time, please do not forget to subscribe. Make sure that as you join in, if you're a new person, subscribe and also become a member of this channel so that you can always be educated. Here, this is a channel for only medical issues, and mostly I talk about reproductive health. I talk about issues concerning fertility and sexuality. So those are issues, they are the issues I usually talk about. I usually see people here asking me questions about children, diseases, questions about several other things. My focus is on reproductive health. So I wouldn't expect questions regarding the other general things. For example, some people were asking me about eye diseases and so on. I would be proud if you ask questions concerning reproductive health. That's where I would be proud when you ask such questions. So straight away, we are starting with question number 1, and this is coming from who was asked today. Let me see who is going to be the first person to ask questions today. All right. All these ones are still greeting me, saying no sound. Okay, I think the sound is back. The sound is back. All right. Okay, so let's straight away go to question number 1, and this one is saying, Mulungi Olivia, hello doctor, I'm in my ovulation time, but I feel pain in my belly. Why? It is normal. It is normal for someone to feel abdominal pain during ovulation. And I think in one of my videos where I was talking about signs of ovulation, I talked about abdominal pain. And abdominal pain is one of the major signs of ovulation. So if you're having abdominal pain and you're ovulating, just thank God. Okay? Just thank God. So what you can do is to take a few painkillers, the NSAIDs, to relieve that pain, but that's okay. It is okay to have abdominal pain during ovulation. So that is not a big issue, and Olivia, it shouldn't affect you so much. Okay, so we come to Beatrice Kiprut is saying, Doc, I have a question today. Please ask, I will answer you. Then someone else is saying, all of you are still greeting me. Okay, so we have another question here. Someone is saying, hey doc, how can I calculate my ovulation day? My cycle is 27 days. All right, 27 days. So let's see how we can calculate the length, someone's ovulation day when they have a 27 days cycle. If you have a 27 days cycle, how are you going to calculate your ovulation day? A 27 days cycle. Okay? So for 27 days, if your cycle If your cycle is 27 days, this is how you are going to calculate the length of your menstrual cycle if it is 27 days. So what you're going to do, you're going to say 27, I'll be very fast here, 27 minus, who should tell me what we are supposed to subtract? Those of you who have been following me, what are we supposed to subtract here? 27 minus what? Those of you that have been following me, if you want to know the ovulation day or the fertile days of an individual with a 27 days cycle, what are we supposed to do? Thank you so much. Someone is saying minus 18. That is true. So we shall say 27 minus 18, and what is the answer? What is the answer? 27 minus 18, what do we get? 27 minus 18, what do we get? Okay, we get 9. All right. So we get 9. So we shall also say that is now this is the beginning of her fertile days. If she has a 27 days cycle, it means her fertile days begin on the 9th day. So then we shall get 9 plus what? We now want to get the ovulation day. Let me have someone who knows what we are supposed to do. 9 plus what? 9 plus what? 9 plus what? I want to know those that have been following me. So it's 9 plus. Okay, yeah, many of you are getting, Takorabi is saying 9 plus 4, Zahara is saying 4. Okay, many of you are giving it here, all of you. Okay, so it's 9 plus 4, which is 13. Okay, then we shall say 13 plus 5, which is 18. So your ovulation day, if the length of your menstrual cycle is 27 days, it means your ovulation day is on the 13th day. Therefore, if you want to have high chances, the high chances of conceiving are on day 13. I hope that is also very, very clear. So, with the length of the menstrual cycle being 27, it means your fertile days begin from the 9th day up to the 18th day, and your ovulation day is on the 13th day. All right, so this one is saying Vanisira 1 is saying, Doctor, please, how long does menses resume after myomectomy? Now, after myomectomy, when menses can resume after 6 weeks. It is possible, even after just 1 month. And you see, the issue is has there been healing? When there is proper healing, menses can resume. So that has no big problem. You should wait for your menses anytime, as long as there is healing. And healing usually takes place by the 4th week. Healing is already done. So in 4 weeks, 6 weeks, you can start menstruation. What can I use to shrink fibroids? Bless the Browning. What can I use to shrink fibroids? What you can use to shrink fibroids, number 1, you can use a medicine called Goserelin. That is an injection. You can also use a medicine called Dupride, and those will be able to help you to shrink the fibroid. All right. Then Joy B saying, "Hello, doctor. I miscarried 2 weeks ago. The funny part is I wasn't aware I was even pregnant. I was only 4 days late. What could have caused it? I wasn't on any medication." There are very many causes of miscarriages. Number 1, one of the causes of miscarriage can be blood group incompatibility. We said blood group incompatibility, and we are specifically talking about rhesus factor incompatibility. Okay? Rhesus factor incompatibility. So what we mean by rhesus factor incompatibility, you'll find that the husband or your spouse, one of you has rhesus factor negative and another one has rhesus factor positive. So if your husband is positive and you are negative, you are likely to have your second pregnancy getting aborted. Okay? That is 1. Then number 2, if you have chromosomal abnormalities, there are some women who produce eggs that have abnormality, they are deformed, okay, and they underwent some mutation and they are abnormal. all sperms being used to fertilize the egg are abnormal, and you'll be having chromosome abnormalities that will lead to miscarriages. Number 3 can be as a result of PIDs. Women with PIDs or pelvic inflammatory diseases are at a high risk of getting miscarriages. Number 4 can be trauma. Then we can talk about diseases and some other foodstuffs. All right, let me go to another question. This one is saying, Doctor, my wife last period day is on 12 December. When will be fertile day? Chest and sharing. If you want us to calculate for you the length, the ovulation day, please give us the length of the menstrual cycle of your woman. We need to know the length of her menstrual cycle. We cannot, by the way, let me tell you people, you cannot, and I repeat this, you cannot calculate your ovulation day or your fertile days if you don't know the length of your menstrual cycle. Most people just guess. You find someone telling you your ovulation day is on the 14th day. Who told you? That happens for those people who have a 28 days cycle, and that is a 28 days regular cycle. Those are the women ovulating on the 14th day. So it's a big mistake for you to assume that your ovulation will be on the 14th day when you have a different length of the menstrual cycle. Therefore, we use the length of the menstrual cycle to calculate your ovulation day. Every person has something different. If you have a 30 days cycle, your ovulation day will be on the 16th day. Someone with a 28 days cycle, ovulation day will be on the 14th day. We've just seen it here. We've calculated someone for 27 days. It will be on the 13th day. So it will differ depending on the length of your menstrual cycle. I hope that is also very clear. Let's go to Abdurrahi Wasame. Hi doctor, my period December 7, my ovulation, tell me doctor. The same thing I'm already saying, that we cannot tell you the length of your menstrual cycle unless we know, we can't tell you your ovulation day unless we know the length of your menstrual cycle. Nabli Merane is saying, doctor, I have an abortion last 5 years. Till now, I'm not being able to get pregnant. I have already 1 kid. I do all my exam, is all right, but the doctor said that I should do mycoplasma test. Now, 5 years you're not conceiving. What I will ask Nabil is, which exams are you talking about? I want you to assure me that you've done a pelvic ultrasound scan, that you have done fertility hormonal assay, a full fertility profile, that you've done it. Tell me that you have done the sepsis screen and you've also done an HSG X-ray. If all of them are normal, that's when you can say you've done all exams and they're okay. But if they are not yet normal, it means, if they are not normal, it means you've not yet started on your journey of curing or of treating your infertility. Infertility is treated by doing several tests, doing several investigations to first of all identify what is causing this infertility. When you identify what is causing the infertility, then treatment or remedy can be gotten. Casey Njagi is saying, do family plan pills cause delay when trying to get pregnant? Yes, they do. They do. Because those are hormonal. Who is this one asking? Casey Njagi. Okay. Because they are hormonal methods of family planning. All hormonal methods of family plannings. Example, injector plan, those pills you're talking about, the implant, they are even hormonal IUDs, because there are IUDs that are not hormonal, but there are also those that are hormonal. All those methods can cause a delay in your menses. So it is very, very possible. Okay. Then this one is saying, Beatrice Kiprut, I have missed my period for 5 days. I feel lower abdominal pain. I feel lower abdominal cramping. What might be the problem? My period is always regular. Second question is, which test should I do to check ovulation? I will start with the last question. Which test can you do to check your ovulation? There is what they call the ovulation kit, the ovulation test kit. You go and buy an ovulation test kit or the ovulation strip. Use your urine to check your ovulation day. It is very simple. It is very simple. It is a one-step thing. The way you do a pregnancy test is the way that can be done. So you go and buy a test strip for ovulation. Then this one where you're saying you've missed periods for 5 days, what could be causing low abdominal pain? Number one, you may be pregnant. You may be pregnant, that is number one. Number two, you may be pregnant because you've missed your periods, and even that abdominal pain can be an early sign of pregnancy. But also, you might have sometimes also delay in getting menses, okay? Those delayed menses, at times people tend to have abdominal pains during the days they are supposed to have menses. Take an example, people who are on implants and people who are on hormonal family plannings, they may have amenorrhea or they may miss their periods. But those days they are supposed to have periods, those people usually experience signs of periods, though they are not going to bleed. They're not going to have bleeding, but they'll experience some of the signs of menstruation. Ronel Godridge is saying, I'm on my period now, all right? It came this morning, all right? What's my ovulation day and what's the cycle length? Ronel Cambridge. You've answered, you've asked something I wanted to ask you back. Because when you asked when your ovulation day is, I wanted to ask you what the length of your menstrual cycle is. But now you came first before me and asked the length. Now, I can't know the length of your menstrual cycle. It is you to know the length of your menstrual cycle. How do you know? This is what you're going to do. Count the number of days in between your menses. If you say period is today, that is day 1. 2, 3, 4, 5. Of course, periods will stop. 7, 8, 9, 10. When you resume periods again, when you get periods again, count the number of days in between. It's like saying how many days are in a week. You say the week has started today, it is a Monday. 1, 2, 3, 4, 5, 6, up to Sunday. Count the number of days in between. You'll find that there are 70 days. So the same applies the length of the menstrual cycle. Count the number of days in between your menses. That is the length of your menstrual cycle. And if you know the number of days in between your menses, you can easily calculate your ovulation day. I hope it is very clear with you, Ronel Combridge. Godbridge. Chetan sharing, Doctor, my wife's cycle is 36 days. When will be fertile days? A person of 36 days, that is an abnormal menstrual cycle length. Therefore, we cannot use an abnormal cycle length to calculate your ovulation day. What your wife is supposed to do is to first treat this. Identify, find out why you're having an abnormal menstrual cycle by doing various tests. Get treated, and then you can now calculate your ovulation day. Because the length of the menstrual cycle is supposed to be between 21 days to 35 days. Anything outside that bracket is abnormal. Lydia, you're saying, I have a 28-day cycle. My period came on 5th December. Please, when is my ovulation day? This should be answered by everyone here. Now, all of you who are on my chat today, all of you who are watching me today live, let's calculate for Lydia. She has a 28-day cycle, and she had periods on the 5th of December. What is her ovulation day? Those of you who have been following me, you can answer this question. So, I want to see answers. She had her periods on the 5th of December. When is her ovulation day? Now, this is what we are going to do. I will give you the working. This is what we are going to do. Because she says she had menses on the 5th of December. The length of her menstrual cycle is 28 days. So, what is her ovulation day? Okay, someone, Nathan Francis, the Catholic guy, is saying her ovulation day is 19th to 21st December. Is it true? 19th to 21st December. Is it true? Is that her ovulation day? Okay. Someone else is saying here, Takorabi is saying 10th, 14th, 19th ovulation day is 14th. Okay? I'm seeing several answers here. This is very good. It shows that you guys are following. Now, let's calculate this and find out what the answer is. Let's calculate it. So, this is the thing. The length of her menstrual cycle is 28 days. So what are we going to do? We shall say 28 minus 18, which is, someone give me the answer? Okay, good. Thank you. 10. Then 10 plus 4 is equal to what? Okay, thank you. Is equal to 14. Now, 14 plus 5 is equal to 19. So, now, according to the answers I've gotten here, Takorabi, you're right. 10, 9, 14, 19. So now, her fertile days begin from the 10th day up to the 19th day. And her ovulation is on the 14th day. Now, let's put it into perspective. She had periods on the 5th. She had periods on the 5th of December. Her ovulation is on the 14th day. Now let's count 5th, 6th, 7th, 8th, 9th, 10th, 11th. This is 11th December. So this is December. 11th, 12th, 13th, 14th, 15th, 16th, 17th, 18th, 19th, 20th, and this is how I want all of you to be calculating your ovulation days. So 19th, 20th, 21, 22nd, 23rd, 24th, and 25th. Blah, 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 up to 31st of December. So now we want to know her ovulation day. We say that her ovulation day is on the 14th day. Therefore, we shall say 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Hey, someone had the answer already here, 18. Hey, people know the answers. Kesbag, your people are learning seriously. Now, so, if we look at this, she will begin her fertile days. Her fertile days will begin on the 10th day. That means her fertile days will begin on the 10th day. This is the 10th day, which is 14th. 14th December, her fertile days will begin. And they will continue up to the 19th day, which is 23rd. 23rd December. So from 14th up to 23rd December, this lady is fertile. Then her ovulation day is on the 14th day. Where is the 14th day? The 14th day is here. So 18th December is when you are ovulating. I hope that is very clear with you, the person who asked. Was it Lydia? I think it was Lydia who asked that question. So I think it is clear. Alex Tadeo, how are you? Where are you calling from? And what is your problem? So, Lydia, I think you now know when you are supposed to ovulate, okay? That it will be on the 18th, it will be 18th of December. That's when your ovulation day will be. So let's get another question here. Maria Claire Basinga is saying, I made a mistake and I took 6 tablets of Clomid in 6 days instead of 5 days. Which day will be my ovulation? Your usual day. Okay? The Clomid is not going to affect your ovulation day. Even if you took a high dose, it is okay. It will not affect your ovulation day. Your usual ovulation day will still remain. Alex Tadeo, say something or we get you off. How are you and where are you calling from? What's your question? Okay, then we have, okay, Nabli Melami is saying, I have done HSG pelvic scan and endovaginal scan, chlamydia test, all is okay. So doctor said that I should do the last test, that is mycoplasma. I am ovulating when I'm menstruating normally, 27 days, but I'm not able. Now, you did all these tests, but you've not yet done the fertility hormonal assay. Nabili Melani, please do a fertility hormonal assay. You may be having a problem with your hormones. And if you have a problem with your hormones, even if all these ones are okay, you'll still not be able to conceive. So please kindly do a fertility hormonal assay to identify what is causing your infertility. Then we have a blessing, a biddy saying, I see my menstrual cycle on November 30th and I have a 28-day cycle. When am I going to ovulate? All right, you have a 28-day cycle. Please, if you have a 28-day cycle, it means your ovulation day is on the 14th day. So if you had your menses on the 30th, it means on the 13th of December, because we shall say 30th, 1st, 2nd, 3rd, 4th, 5th, 6th, 7th, 8th, 9th, 10th, 11th, 12th, 13th. On the 13th day of December, that was yesterday, that is when you had your ovulation. So, blessing ability, if you had sex yesterday, then you had sex on your ovulation day. I think that is also done. Okay. Cheten Sherang is saying, what should you need to do for an abnormal period, doctor? For abnormal periods, I would request you to do tests. First, do tests, run tests. Okay? Run tests, do tests to identify what is causing your abnormal periods. I've already discussed, I've had a video, I had a video here talking about causes of irregular periods, all abnormal periods. And in that video, we talked about things to do with hormonal imbalance. We talked about things to do with masses. Okay, we talked about masses, or masses like fibroids. We talked about people having cysts, those hemorrhagic cysts and even non-hemorrhagic cysts. All those ones can cause hormonal imbalance. We talked about people, can cause irregular periods. We talked about people with using contraceptive pills, etc. So what you're supposed to do is to find out what is causing your irregular periods, all your abnormal periods, and then when you know that, medicines can be gotten. Joy B, you're saying, my first pregnancy was a twin pregnancy, boy stroke girl, okay. Unfortunately, one died after 5 days. They were identical. Second was born a girl, 2 years now, and miscarried another 2 weeks ago. How do I conceive twins again? I have always talked about techniques that can be used to conceive twins. And I've always talked about gonadotropins. So you need to calculate the length of your menstrual cycle very well and take gonadotropins like the likes of letrozole, the likes of clomiphene, the likes of tamoxifen can be taken and someone gets pregnant. Then a blessing ability, this is 14 days menstrual. Okay, I have not gotten you. When is the right time to test ovulation? The last time to test, the right time to test ovulation is during the ovulation period or during the fertile days, okay? So test, if you want to do an ovulation test, do it during your fertile window. Okay. Sahra A is saying, hello everyone from USA. Yeah, okay, say hi to those Americans. Okay. Then we have another question here. Okay. What is the question here? These questions keep on running away, and most of you will now say, Doctor, you didn't answer my question. Doctor, you didn't answer my question. But sometimes the technology takes it away. Okay. Doctor, help me to check. Help you to check what? Mpirire Charity, I help you to check what? What is your question? I don't understand the question very well. Lydia is saying thanks. All right, welcome. Anna Bere Ijiome. Anna Bere Ijiome, from which part of the country are you? From which part of the world are you from? Where are you from? Ijiome. You're likely to be, I don't know. Okay. Ijiome, you're saying, sir, please answer me. Answer me. What is the question? Please, if you say I've not answered the question, just bring it back. These questions keep on running because there are many. They keep on running, and I fail sometimes to pick some of your questions. So when you see your question not being answered, repeat it. Just repeat it. I will keep on answering. I will answer. Just keep on asking. I'll answer. Then Lydia is saying, can I test my ovulation on morning or evening? Better in the morning. Morning urine is better, but you can test it on any other, during any time. But morning is better. Annabella is saying you need to be answered in Pirire mine question up. Question up, yes, I know the questions may be up, but whenever I scroll, some of them run out. So please, when you see me, when you realize I've skipped your question, just keep on asking. I'll maybe land on it. So bring your questions back. Now, Annabella Ijome, you're from Cameroon. Oh, okay. How are the Cameroonians? Okay. Another question here. Someone is saying, Doctor, my wife, I think I finished this one. Then, please, when you see your question is being skipped, you can ask again. Hello, doctor, how can I treat an ovarian cyst? All right, an ovarian cyst. So we said, I think in one of my videos, I talked about what an ovarian cyst is. An ovarian cyst is a mass, soft, okay? It is a soft mass, which is filled up with fluids, okay? You can call it which is filled up with water. It is filled up with fluids, okay? An ovarian cyst can be found on any body part, on any part of the body. But I mean, a cyst can be found on any part, on all the parts of the body. But an ovarian cyst is found, you find it at the ovary. It is usually called a tubo-ovarian mass because sometimes it implants itself or it grows between the fallopian tube and the ovaries. So that is why we call it a tubo-ovarian mass or a tubo-ovarian cyst. So this cyst is most times caused by infections, okay? It's most times being caused by infections. When you get infections like PIDs and you fail to treat them very well, or if you don't give them satisfactory treatment, or if the bacteria is resistant to the medications you've given, sometimes it becomes a cyst, okay? It forms a shield which is filled with water, and you end up having a cyst. Treatment is to take antibiotics. Sometimes you can get these cysts as a result of hormonal fluctuations. So that's it. Jenny Bless is saying, previously I had missed abortion, 7 weeks. What will that affect? Will that affect my next pregnancy? Now, if you get missed abortion, before you plan on conceiving, first find out what caused that missed abortion, okay? Sometimes it's as a result of probably you had some infections, you had something, you had an abnormality somewhere. Then if there was an abnormality somewhere, you need to first treat it. When you treat that abnormality, you'll be able to have a live pregnancy again, okay? So it's better. But it is not that whoever gets a missed abortion will continue getting missed abortions. No. We've seen people getting missed abortions, but then they conceive again normally and have live babies. So that should never stop anyone from conceiving again. A missed abortion does not mean that you will still have missed abortions over and over again. Another question, Kyra is saying, Doctor, what are PIDs and how can I treat them? PIDs are pelvic inflammatory diseases. These are diseases that affect the pelvic tract, okay? And that is to say, from the vaginal area or from the vagina to the cervix to the uterus, the fallopian tubes, to the ovaries. When there are infections there, we call them pelvic inflammatory diseases, all infections. And those ones are caused by bacteria, sometimes fungi, and rarely viruses. So when you have them, you take antibiotics. Usually, all the commonest causes of PIDs, or pelvic inflammatory diseases, are E. coli, trichomoniasis, and chlamydia. That's why when we are giving treatment, we combine, or we give medicines that can kill, or that medicines against chlamydia, that infection, medicines against trichomoniasis. So medicines against chlamydia include the likes of doxycycline and all those tetracyclines, plus also at times azithromycin. Then we also give you medicines against trichomoniasis, of which they include the metronidazoles of this world, tinidazoles, etc., all those anaerobes and so on. And then we can also give you cephalosporins cephalosporins and several other medicines. The amikicides, gentamicins of this world, and all those medicines can be used to treat the PIDs. I hope I'm very clear there. This one is saying, hello doctor, I'm trying to conceive. I used to see my period on 15. Dr. Victoria Kahenje. Hello doctor, I am trying to conceive. I used to see my period always on the 15th. So what is the point? What is the question? Please ask your question very well. What exactly do you want to know, Miss Victoria Kaheng? Babia Shamira 14. What do you mean 14? Oh, you're giving us an answer. Shamira, hey, we finished that long time ago. Maybe your network is disturbing. You're giving us the answer right now. We finished that topic long time ago. Ntale Jenny is saying, Doctor, I am 40 weeks pregnant and no signs of labor. What can I do? Go for labor induction. But 40 weeks, first wait a little bit. Yes, we say full term is 40 weeks. Okay? At 37 weeks, you're already at term. Full term is 40 weeks. But we can give an allowance of plus 2 weeks. Okay? So you'll wait for 41 and 42. When you reach 42 weeks and you've not yet gotten signs of labor, go for labor induction. Induce that pregnancy, and if induction is not possible or if it is contraindicated, how? For example, if you had previous cesarean section, if you have a previous scar, you had a cesarean section in your last birth, you're not supposed to do labor induction. And very many other contraindications. For example, if the child is not cephalic, if it is not the head facing down and it is the buttocks or the legs, the feet, you are not supposed to do labor induction. But if there is no contraindication to labor induction, you can try and do induction. Then after you'll be able to conceive. If you don't do induction, you can go and do a cesarean section if it goes beyond 42 weeks. This one is saying, Takorabi Babra, Doc, I didn't understand on the question of Lydia. She's 28 days cycle and she saw period on 5th December. She asked about ovulation day, you said 18th day. Calculate for me again. No, don't get confused. You see, we have these things. We have what we call the calendar day and the menstrual day. As far as the menstrual, when you are doing that calculation, we calculate for the menstrual day. She's supposed to ovulate on the 14th day of her menstrual cycle. So if you count 14 days from 5th when she had her menses, you'll find yourself on the 18th of December. So her ovulation day is the 14th day of her menstrual cycle. But in December, she will have her ovulation on the 18th of December. I hope that is clear. If it's not clear, ask again. I will answer. Bamboo Evelyn, where, from which part of the world are you? Which country? Bamboo Evelyn. Okay, doctor, what can do after all infertility tests and you still fail to conceive? Which tests have you done? List them for me. Because when you see, people usually say all fertility tests. Which tests? You list them for me. And again, after doing fertility tests, you don't stop there. You intervene. Where you find a problem, you get treatment. So, I need to first of all know which fertility tests you have done. Nathan Francis, the Catholic, her ovulation day is 19th to 21st. Okay. Scovia Nantongo is saying, hi doctor, it is 10 days past ovulation. I'm expecting my piece on 16th December. But feeling like vomiting, heavy breasts, fever, flu, yet other cycles I didn't have flu and I didn't have flu. Can it be menses or pregnancy? Both. It is possible to have both. Okay? Time. Minutes left. Okay, so we have only 5 minutes for us to stop TikTok, and then we shall only be continuing with YouTube. So those of you on TikTok, in a few minutes you'll be finding us on YouTube and still ask questions. We shall answer you. Let's continue. So in 5 minutes TikTok will be off and we shall be continuing with only the people on YouTube. Now, Jesselyn Wesley, Lydia, start your ovulation test after the end of your period. No, Juliano Wesley, no, this is wrong. This is wrong. Don't advise like that, my dear. Please. You do not start counting at the end of your periods. You don't start counting at the end of your periods. You start counting from the start of your periods. Please get this very clearly. You start counting from the day you see your periods. The day you see your periods is day 1. The moment every time you hear me say on the 14th day, on the 15th day, I mean from the day you've started seeing periods, not from the day you've ended periods or you've stopped periods. So this is wrong. Please correct it, my dear Wesley. Chavita Joan is saying, hi doctor, I have tried to get pregnant, but I'm not getting pregnant. I'm not using family planning and my cycle is 28 days. What can I do, or what is the problem? What is the problem is is that you fail to get pregnant, but you are not doing tests. I want you to go and do an ultrasound scan, find out whether you don't have any masses, any swellings in your uterus, all in that line. Then do fertility hormonal assay to ascertain your menstrual the hormonal status, your hormonal status. Do an HSG X-ray to confirm you don't have blocked tubes. Those are some of the causes of infertility. If you don't have any, then that's when we can say you've done everything and you're failing. Also, by the way, have you tested your husband? Is he fertile? Have you done sperm analysis? So before you start blaming yourself, do those tests, identify what is causing the problem, get treatment, and you'll get fine. Okay, so I think we shall be leaving our people on TikTok. Let's leave them, and you should join us on our YouTube. So we've gone to YouTube. All of you on TikTok, follow us on YouTube, and we are continuing with our people on YouTube. Okay, so we are continuing. Hi, doctor. I have tried to get, okay, this is done. Ability, you're saying, doc, I am suffering by the Bartholin cyst. It's the Bartholin. I think you're talking about the Bartholin cyst. It was swollen and the doctor drained it, but still coming back. I'm suffering from hormone imbalance too. I want to know what to do with infertility. Now, the first thing you're saying, you have a Bartholin cyst. A Bartholin cyst, after draining, when we are treating Bartholin cysts, we do what they call marsupialization. It is a procedure called marsupialization. This marsupialization, we open this cyst, we drain it. After draining it, we suture it from outside so that it doesn't form again. That is marsupialization. If it is not done like that, there is a likelihood of it coming back. If you just drain a cyst, a Bartholin cyst, some people just go, this is the cyst, and they cut here, remove the pus or the fluids that are there, and they leave it like that. Sometimes it forms the fluids again. So what you're supposed to do is marsupialization. Marsupialization is done by doing this. This is what is done in marsupialization. With marsupialization, you have a cyst. You have a cyst, for example, this is the cyst, and it is down there in your vein. So what we do is that we cut through it. We make an incision here, and we open the cyst. Now, when we open it, it means we shall be having something like this. My drawings. We shall be having something like this. So it's opened. Now we take this flap. I don't know how I will draw. We take this flap here and suture it from this side. And also take this flap here and suture it from this side. So at the end of the day, we are going to have, if this was the cyst, my drawings, if this was the cyst, after opening it like this, we take this part this side and this part this side, and we leave it open. That's how we suture, and that will make sure that the cyst doesn't come back. We also give you antibiotics to treat, in order for proper healing, and also to kill the bacteria that cause infect those cysts. P, suggest for PCOS. To suggest what? What exactly do you want him to suggest? PCOS. What do you want me? Specifically, what do you want? She's fit is saying, Doc, can one conceive with no cervical mucus? Please, we like to know. Yes, it is possible. Some people can have ovulation with no cervical mucus. It's not that everyone with ovulation, for one to have ovulation, there must be cervical mucus. There are people who will not receive cervical mucus. They will only have some abdominal pains or pains in their breasts and so on, and they will still have ovulation. So you can still have ovulation without cervical mucus, though cervical mucus is a big indicator of ovulation. Susan Waithera is saying, you have skipped mine, please answer. If I have said that if I skip your question, please ask again. Ask again. Sometimes these questions are many and they keep on. Sometimes when I scroll, one question goes away. So if I skip your question, just ask again. Madua Jessica, Doctor, answer. I answer what? What is your question? I think to them, as if I'm skipping many people's questions. I'm sorry, I don't know. Eke Ibrahim, please, doctor, what's the best contraceptive method? The best contraceptive method depends on you. Not, as a doctor, we may not know what the best would be. The best depends on your body. Some people, it's better to use non-hormonal methods. Others, it's hormonal methods. You'll find that others are hypersensitive to IUDs, to the copper T. Some people, it's better for them. The best method would be vasectomy. Others, it is bilateral tubal ligation. So it depends. What you're supposed to do is to have an individualized talk with the doctor. They will ask you, how old are you? When do you want to have children again? Are you exposed to infections? A lot of, after that chat, you can now be able to decide the best method of family planning. Maybe if you asked me the method I would use, all I would use for my wife, that's when I can tell you this. But for you, you need an individualized talk with the doctor, have a family planning counseling session, and then plan on which method to use. Havi Choma, hi doc, my menstrual cycle keeps on reducing. Kindly help me. What causes that? I am trying to conceive. That is likely to be a hormonal imbalance issue, or maybe you have some fibroids or any masses there. Lydia, my sister is not ovulating. What are the causes? Causes of ovulation, it can be as a result of low levels of luteinizing hormone, or high levels of prolactin, or even poor estrogen. Now, that is likely to be a hormonal imbalance issue. Mpirirwe Charity answer. I don't know what to tell you, because if you don't ask the question again, I may not be able to answer. Okay, Mpirirwe Charity, my length is 28 days, okay? And 23 November, it was my first day of period. From 30th November up to 4th December, I have unprotected sex. Was I safe? Oh, Mpirirwe Charity, let's calculate for you. Charity, let's calculate for you. And I want you to be attentive, and you should be able to answer me what I ask. Now, according to what we've been doing, if you have a 28-day cycle, what are we supposed to do? Someone answer me. We shall say 28. Someone get me the answer very, very fast. Those of you who know our calculation, if you have a 28-day cycle, we want to calculate for her the fertile days and find out whether she had sex during the fertile days or not. So, 28 days, what are we supposed to do? Okay, we are supposed to say 28 minus 18. And the answer is, what? Alberta is saying 25 minus 14. Oh, no. Senesi, no? Okay, Senesi, just give me the answer for 28 minus 18. Mpirirwe Charity, you asked this question, and I want that answer. What is 28 minus 18? Okay, so you get 10, thank you. Okay, all of you are getting it. 10. So it is 28 minus 18, you get 10. So what is next we are supposed to do? We are supposed to say 10 plus what? Okay, yes, 10 plus 4. Which answer do we get 10 plus 4? Okay, 14, thank you. 14. So we have 10 plus 4, which is 14. And then 14 plus 5, what do we get? 14 plus 5. 14 plus 5. 14 plus 5, what do we get? All right, thank you. We get 19. Now, Mpirirwe Charity, your fertile days begin from the 10th day up to the 19th day. From the 10th day up to the 19th day of your menstrual cycle is when your fertile days are. And your ovulation is on the 14th day. Now let's visit your question. You said that you had you had periods on the 23rd November. So now let's have our November calendar here. 23rd of November. So we say 23rd. Give me a black one. Okay. So 23rd. This is November. Okay? So 23rd November, 24th, 25th, 26th, 27th, 28th, 29th, 30th November. So 1st of December, 2nd, 3rd, 4th, 5th, 6th, 7th, 8th of December, 9th of December, 9th, 10th, 11th, 12th, 13th, 14th, 15th. Okay, so let's stop there now. Now, we know what we know. The facts you've given us is that you had 23rd of November, that's when you saw your first periods. So, let's look at this. When did your fertile days begin? 23rd, so this is day 1, day 2, 3, 4, 3, 4, 5, 6, 7, 8, 9, that is first, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23. So, according to this, your fertile days began on the 10th day. 10th day was 2nd. 2nd of December is when your fertile days began. This is the 10th day. I hope I'm right. Yes. Yes. On 2nd of December. That was your 10th. That was the 10th day of your menstrual cycle. It means your fertile days began from the 2nd. Now, where is 14th? 10, 11, 12, 13, 14. Here, 6th December was your ovulation day. I think you're now getting the answer. 6th December was your ovulation day. And your fertile days ended on the 19th day, which was 11th. End. Start of your fertile days, end of fertile days. So your ovulation day was on the 6th. So now let's see when you had sex. I had unprotected sex on the 4th of December. 4th of December. Where is 4th? 4th of December is here. You were not safe. You were in your fertile days, and therefore you can conceive. Though this was not the ovulation day, but there are still chances of you conceiving. I hope that one is very, very clear. Let's go to another question. Okay, and I'm left with a few minutes to go. Let me answer this. Jenny Bless, thank you, Doc. I have been following your classes and I'm hoping to conceive soon. All right. Thanks for appreciating. Check me, doctor, please. I check what? What medicine can I use for hormonal imbalance? Albert, heavy trauma. When we say hormonal imbalance, it is a broad word because a woman has several fertility hormones, okay? And the commonest are 10 hormones. So when you say hormonal imbalance, we shall ask you which hormone specifically has a problem. We need to know which hormone specifically has a problem. If we don't know the hormone specifically that has a problem, you can not get treatment. We ask ourselves, is it progesterone? If the problem is progesterone, you will take progesterone drugs. Is it luteinizing hormone? The menopause are there. If it is estrogen, medicines are there. So the issue is which hormone specifically is imbalanced. Heavy trauma. Can endometriosis be cured? If yes, then how? Trauma, endometriosis is really a very long topic. check in one of my videos. After this live, check in my videos. I think it is the latest video I have uploaded, isn't it? It's the latest. Check the latest video I have uploaded. Go to my channel, Ask Dr. UTHUMAN. Check the latest video I have uploaded, and it's talking about endometriosis. It has a very clear description. Please kindly go and check. Listen carefully. Watch it very well. Listen carefully. You will understand what ovulation is. It is broad. I really explained everything to do with ovulation. At least when you watch that video, you get the answer you want. If you do not get everything you want, then come back in the next live and ask specifically when you know when you have at least some background. I think I'm going to read only 2 questions, and then we close this live today. Shy Fit is saying thank you. Okay, all right. Chabita Joan, doctor, what is the earliest period can I test for pregnancy? The earliest is 10 days. 10 days. But sometimes when you're using a blood pregnancy test, sometimes it can show by 7 days. 7 to 10 days it can show. But the normal urine pregnancy test, you can test from 10 to 14 days. So 10th is the earliest you can do a urine pregnancy test. Sahira A, doctor, if have hormonal imbalance, what do I know? How do I know which doctor do I have to make an appointment? Family doctor or fertility doctor? Sahila, I don't know. It depends which one you want to see. I don't know. Maybe you are in the US and it is a different system. That's why you're asking about which doctor, family doctor, fertility doctor. But probably I think you need to really see a fertility doctor. A fertility physician will be able to solve your problem. And for me, if you'd like to have an appointment, you can book an online appointment or using the website www.druthman.com. There is a procedure which you pass through. You book an appointment, you can have a one-on-one chat with me privately. Okay, I think so that is how you can get me. That's how you can have a private chat. Behind my camera today is Mr. Kesberg of IT.next. Please do not forget to go to his YouTube channel and subscribe. The name is IT.next. He's a very good expert in information technology, and I know he can help you. All of you, my followers, go and follow him. Follow IT.next. He can help you in one way or the other. There are a lot of things you can learn from his channel. And if you'd like to have a private chat, a private conversation with me, go to my website, www.druthman.com, and book an appointment. I'll be right there to chat with you. Do not forget, if it's your very first time to watch my videos, please do not forget to subscribe and also press the notification bell in order to be notified of any important videos we upload. And those of you who would like to become members of my channel, please join. There is that button there showing you that you can join, become a member, and you can have benefits. One of the benefits, the perks we've put, you can have a one-on-one chat with me via a video call, and that can take a period of 1 month when you're consulting on any day of your choice. Thank you so much. It's been a lovely audience today. I think I'm going to sign out. Don't forget, tomorrow we are releasing a video concerning, this video. What do you do when you get raped? If someone rapes you, what do you do if you went to your boyfriend or you went to your girlfriend and you had sex unexpectedly? You didn't expect to have sex. You didn't even use a condom. You didn't do any protection. What are you supposed to do? That video is going to be out tomorrow at exactly 8 p.m. That is 20 hours East African time. Watch it. It's very, very important for you and your friends. Thank you so much. Sign out.